One person has pain on the right, another on the left, a third feels burning, and a fourth has chronic pain. They cause tension directly in the lumbar region of the spine, but that's not exactly the job of the piriformis muscle to move the leg backward. The muscles of inhalation are those muscles that lift our shoulders upward. And there are also the muscles of exhalation which lower our shoulders. The muscle attaches from the lower rib to the crest. Hello everyone, friends. As always, we're on the Healthy Movement channel. Today we're going to talk about a rather interesting topic. We're going to talk about back pain, specifically about the situations and what exactly bothers us in our back. As you understand, there are different cases. One person has pain on the right, another on the left, a third feels burning, a fourth has chronic pain, and a fifth has pain radiating down the leg. Today, we will go through all these cases and learn how to relieve different types of pain with the help of exercises. So please stay tuned to the channel, subscribe if you haven't already, and let's get started. So first of all, chronic pain that occurs in about this area. What could this be? It could be a general spasm of our quadratus lumborum muscles. Our quadratus lumborum muscles attach to the lower rib as well as to the crest of our pelvis. Accordingly, when they are contracted on one side or the other, we feel tension in them, and as a result, we feel pain in them. The cause of this could be a forward tilt of the pelvis and pronounced hyperlordosis. Today, first we will discuss what to do about this, how to stretch, and how to restore these muscles to their normal tone. Next, the piriformis muscle, also known as piriformis syndrome. We encounter this quite often in our practice. What appears? What kind of pain? The pain can be roughly in this area of the buttock. The pain can radiate down the leg, causing a burning sensation, or perhaps a chronic, constant pain. In some positions, it may even get better, while in others, on the contrary, it gets worse, depending directly on the condition of the piriformis muscle. Why can this happen? Let me explain. The gluteus maximus muscle is shown here. Its function is to move the leg backward. Accordingly, when our gluteus maximus muscle does not properly perform its function of moving the leg backward for a long time, synergist muscles appear that start to help it. And in this case, the piriformis muscle gets involved, our piriformis muscle starts working, but moving the leg backward is not really its job. As it tries to perform this function, it contracts and begins to compress the sciatic nerve. Against this background, we experience localized pain, which can also radiate down the leg. What should we do about this? I will also show this today in the exercises. And third, the interscapular area. The pain can be somewhere here at any of these points. It can radiate between the ribs, radiate upwards, or it can just be a constant localized pain between the shoulder blades. What does this mean? This indicates constant static overstrain of the interscapular area. Let me explain, we have the muscles of inhalation. These are the muscles that lift our shoulders up. And there are also the muscles of exhalation, which lower our shoulders during the act of inhaling and exhaling. Accordingly, when our inhalation muscles are too strong and overstrained, the exhalation muscles will always be too weak because they are antagonists to each other, and with static overstrain, trigger points will appear in them. What does this mean? It means that the back is trying to return our shoulder blades to their physiologically correct position like this, but these muscles lack the strength, and as a result, they are constantly in a state of static overstrain, developing so-called trigger points. And today, we will also discuss what to do about this, how to bring our shoulder blades back into good posture, and how to relieve the constant overstrain that can radiate to the neck, between the ribs, and sometimes even downward. So stay tuned to the channel. Let's start doing the exercises. So the first exercise, we will be stretching the quadratus muscles, which most often cause tension directly in the lumbar region of the spine. They cause that chronic, constant pain when extending. So what do we need? First, we need to find a doorway. Why? So that you can grab onto the doorway with your hands and hold on just like this, as you can see Vlad is doing now. Second, we need to pull back. At the same time, round your pelvis as much as possible. Your knees can be slightly bent. And third, we do these stretches of the quadratus lumborum muscles to the left and right. Let me remind you, the muscle attaches from the lower rib to the iliac crest. So when we do these twists to the left and right, our muscle stretches. We perform this exercise 15 times on each side, taking our time and avoiding any sudden, overly sharp movements. If you experience sharp pain while doing this, it is advisable to stop the exercise. Use gentle movements to the left and right. You can use your breathing to help exhale with each movement to help the muscle relax even more. When we turn to the left leg bends accordingly. When to the right leg bends accordingly. 15 repetitions on each side. So, the second exercise. Pain in the piriformis area right here. Sit down on a chair. Take the leg that bothers you and place your foot on the other leg, and what do we do next? We simply lean the torso forward, thus stretching the piriformis muscle, and then return to the starting position. If there is sharp pain, do not push into it, go only to the edge of the pain, then return to the starting position. Do 15 to 20 repetitions like this. Be sure to exhale as you lean forward. I recommend doing this. Why is this necessary? First of all, we don't strain ourselves and our blood pressure doesn't rise. Secondly, by exhaling, we help our muscles stretch more and assume the correct physiological position, thereby reducing compression on the sciatic nerve and, as a result, decreasing overall pain. You can also do 15 to 20 repetitions on the side that doesn't bother you at all. And the third problem is pain between the shoulder blades, which can radiate anywhere, upward, downward, into the ribs, and sometimes even into the pelvis. Our task is to engage the exhalation muscles, which need to be strengthened, and pull our shoulder blades downward. How do we do this? Place your hands in front of you, like this. On the exhale, bring your shoulder blades together and pull your elbows downward. Make sure that the upper portion of the trapezius muscle does not tense up. Only the area between the shoulder blades and the lower trapezius, the lower part of the trapezius muscle, should be engaged. Do 15 to 20 repetitions like this. If there is sharp pain, we avoid it. Work within the range of motion that does not cause sharp pain. If it still occurs, it's better to stop and consult your doctor or physical therapist. At the same time, our neck remains in a neutral position. It does not move forward or backward. Our goal is to strengthen only the area between the shoulder blades and a little below it. It is advisable to exhale with each repetition, again to prevent your overall blood pressure from rising and to make performing the exercise itself easier. I assure you that you will feel relief right after the exercises because you will be working with the trigger points in this area. As a result, blood supply there will improve, tension will decrease, and the pain will gradually subside. And at the very least, with the help of this exercise, you will improve your posture. You won't have rounded shoulders, your shoulders won't be hunched forward, and at the very least, you'll look better aesthetically. How did you like this episode? Did you enjoy it? Should we go into more detail about the problems of localized points in our spine or joints? Please let me know in the comments. It's important for me to know whether to talk about things in general or to focus specifically on the different syndromes that can occur with back pain, pain in the area between the shoulder blades, neck pain, and so on. If you did enjoy it, please like and subscribe to the channel. I'm always happy to read your comments and stay healthy.